Hi there, how are you? So this is the first video I've done in a while. I've been on maternity leave. Lots has been going on, lots to fill you in on. But today I wanted to talk to you a little bit about magnesium and how important magnesium is. And I realized this myself after breastfeeding for 7 months and then doing a move. I just noticed how stressed I was and how it was coming out of my body. Lots of muscle aches, difficulty falling asleep, difficulty relaxing, some constipation, restless leg syndrome, and I just could feel my nervous system and that sympathetic nervous system, you know, that fight or flight. When it would come time for me to try and relax, I just couldn't relax. I just could not bring my nervous system down. So I realized how important magnesium was and actually how much I had neglected it. And magnesium is so important for us, but it's particularly important for us if we're suffering during our menstrual cycle, particularly during that luteal phase, particularly if you're experiencing things like anxiety, depression, pain, cluster headaches, migraines, headaches, those kind of symptoms. Magnesium is super, super important, and it's something that you can put in on a daily basis. And it's also something then you can increase the dose so you kind of get a little bit more of a therapeutic dose to support you during these times in your cycle. There are lots of different types of magnesium, so it can be confusing. You know, we've got magnesium threonate. That's a beautiful magnesium, and it's actually used for brain health. It's more used for brain health, working memory, supporting brain function, and boosting brain function. And it's been shown to work really well. We've got magnesium citrate with an amino chelated form. So sometimes the magnesium is chelated with an amino acid like glycine, and so that's a glycinate form. That's really good for that kind of pain and relaxation. And then there's magnesium oxide. Magnesium oxide is really great for supporting the bowel. It actually helps with constipation, so you can take it in a small amount just to get your bowels going, to soften the stool. Some people take it in a larger amount for a really good bowel cleanse. Then we've got beautiful magnesium sulfate. That is what's used in Epsom salt, so they're magnesium sulfate. That's beautiful for detoxing and also calming and relaxing the muscles. So having a bath with a lot of magnesium sulfate or using magnesium sulfate spray is beautiful to support your muscle health. Magnesium sulfate is actually an interesting one, and that has been used, and there are studies that show that that has been used intravenously for asthma. So we can see how vital magnesium is then for just relaxing everything. You know, asthma is where the bronchioles kind of constrict, and then they get lots of fluid and they get mucus in them, and then you get the kind of asthma symptoms. And what magnesium helps to do is kind of open up those bronchioles and help with the breathing, kind of enlarge the lung capacity. So it's super, super important. I use magnesium a lot for my PMDD clients, my PMS clients who have flare-ups in the luteal phase. So these cyclic flare-ups. And if you're tracking, and if you've been following me for a while, you might be tracking your cycle, and you might find there are times in your cycle where you get more pain perception, you might get headaches, you might get muscle aches, you might get knee pain, all of these kind of things. And there is one study that's been done that shows that women that suffer from PMS and PMDD actually have a lower intracellular magnesium. So that's telling us something. That's telling us that we really need to look at upping those magnesiums to support the body, whether you do it through diet, whether you do it through supplementation. But what we do know is when you're getting stressed, when you're going through more pain, when there's a lot going on, like moving or having a baby, you're going through your magnesium a lot more. So you do have to think therapeutically about it. Now, magnesium glycinate, magnesium citrate, wonderful, as I said, for relaxation. So what you're looking at as a therapeutic dose is about that 300 to 500 milligram tablet or powder 3 times a day. So this is a higher dose. This is therapeutic. So you can do this in your luteal phase, which is those 2 weeks before your period. You can do it during the time when you know you suffer the most. When do you get those pains? When do you get those cluster headaches? Leading up to that, do this therapeutic dose of 300 milligrams to 500 milligrams a day. With PMS symptoms, there's a whole category of PMS symptoms: anxiety, depression, pain, water retention, bloating, headaches, moodiness, insomnia. I mean, there's a ton of different symptoms, and everyone gets a kind of PMS symptoms in a different way, some more severe, some don't get them at all. But what has been shown is what's interesting is daily for 2 months. So this is a longer term strategy rather than therapeutic. Daily for 2 months, around that 250 to 300 milligrams of magnesium once a day, coupled with a B6. And we're looking at around 50 milligrams to 100 milligrams of B6. P5P is the activated form, and that's my preferred form. Combine those together for 2 months daily. That has been shown to help those PMS symptoms. So the PMS symptoms are what come cyclically. We're not talking about everyday symptoms. If you're puffy and you've got water retention every single day, then we're looking at more low progesterone or maybe low thyroid as a chronic issue. But if you're having the cyclic symptoms, so for two weeks, 1 week, 10 days, however it is for you, that's those cyclic PMS symptoms, premenstrual syndrome. And you might get the water retention. So we're looking at around 250 milligrams to about 50 milligrams of B6 taken daily, and we're looking for about 2 months. Those have been shown to reduce the PMS symptoms. So that's your longer term strategy. If depending on the tablets, some are 100 milligrams, some are 200 milligrams, you can go sort of up and down from that. But that one tablet and then the B6. Sometimes they do come together, but you might have to also get them separately. And do look out for the P5P, the activated form of B6. That's what you want to be doing. And with the magnesium for these particular symptoms, you want to be going with a glycinate form, maybe a citrate form, not say the oxide or the 3 and 8 forms, because they're not particularly for that. So in terms of therapeutics for the magnesium, daily about your 200 to 300 milligrams coupled with your B6, which is your 50 milligrams. That's daily, that's ongoing, that's your plan. If you suffer severely in the luteal phase, you want to up that therapeutically. Or if you're going through a real severe time, you're going through a lot of stress, you might be going through a lot of stress now, you're moving, you've just had a baby, there's all sorts of things that are going on. So you want to up that then for a short period of time, 300 to 500 milligrams 3 times a day to battle that acute stress, not the chronic stress. And then if you're getting any mental emotional symptoms, anxiety and depression particularly, what's been shown is around 400 milligrams of magnesium a day helps that long term. So you're kind of upping that daily amount. So that's kind of how I work with my clients when they've got issues with PMDD, PMS, depression, the luteal phase issues. That's how I use magnesium. Now, of course, sometimes there can be issues with muscle fatigue and headache. So that real muscle fatigue, we're looking at maybe using like a malate form. Malate helps with the energy supply in the body, ATP. So if you're getting kind of fibromyalgia, chronic fatigue, those kind of symptoms in your luteal phase, those real, just completely depleted. You're walking up the stairs and your muscles are very, very weak. Your legs feel heavy. You want to have a look at the malate form. And malate form can be harder to get, but that's been studied more for getting the energy into the cells to support the body, particularly during the luteal phase. Now, in terms of magnesium sulfate, I love using magnesium sulfate purely kind of more detoxifying. It's really great for detoxifying, and studies have shown that in terms of using the Epsom salts for that relaxation of the muscles and also that detoxifying effect, you want to go for a high amount. So sometimes when people use Epsom salts, they might just use a little bit of a cup, but you really want to go high amounts. So they come in boxes of like 200 grams up to about 1 kilo. You can get big bags. You want to be doing about 500 grams per bath. So that might be 2 small boxes, half a big box. That's a lot. And that's what's been shown to be therapeutically relevant. If you're just putting a tiny bit in, you may not notice a difference. But if you suffer from PMS, any pain, any muscle tension, severe symptoms during your luteal phase, try that bath with a therapeutic magnesium sulfate in, the therapeutic Epsom salts. You're looking at about 500 grams. And again, when you're using the magnesium spray, you're not just using it once, you're spraying yourself like every 4 to 6 hours and just continually doing that through this difficult period in the luteal phase to get great results. So that's how you can use magnesium. And I think what I've touched on is specifically for your luteal phase issues. If you find you have problems every day, then go for that kind of lower dose magnesium. So go for about the 300 milligrams of magnesium every day. And then if you're having problems in your luteal phase, that's when you need to sort of push in and you need to have your higher dose magnesium. So you're looking for magnesium citrate, magnesium glycinate. Daily is around that kind of 200, 300 milligrams with about 50 to 100 milligrams of activated B6, which is called P5P. Therapeutically, you're looking at about 500 milligrams of magnesium, and you're having that 3 times a day. So I hope that you found that helpful. I have put some links to my favorite supplements. Doctor's Best do some great supplements. Thorne do a really good magnesium malate. Life Extension does a good combination magnesium. Life Extension also does the magnesium threonate, which is great for your brain. It's great for memory, working memory, retention. And then if you're just going to a local pharmacy, if you're Australian and you're just going to a local pharmacy, Ethical Nutrients do a great tablet called Mega Mag. Metagenics also do a great tablet as well. I kind of tend to stay away from the really high dose powders. You're getting up to 1 gram, up to 3 grams, because you'd rather take it in divided doses than one big lump sum at once. So I would go 500 milligrams is the highest I would go, and I would just take that in divided doses through the day. So your body's absorbing and you're not just losing it in your urine. So I hope that helped. If you've got any questions about magnesium, please pop them below. Take care. Bye.